Let's move on to part 2 of our pediatric series, Lysosomal Storage Diseases. This corresponds to competency PA 11.3. To understand the disease, we first need to understand the machinery. Think of the lysosomes as the cell's recycling plant. Panel A, normal physiology. In a healthy cell, enzymes act like workers. They take complex molecules or substrates, shred them, crush them, and recycle them. Panel B, the pathology. Now look at what happens in disease. The enzymes go on strike. They are missing or defective. The result is the trash or metabolic substrates piles up inside the lysosome. The consequence is the factory swells and eventually bursts. So the pathogenesis equation is simple. Enzyme failure leads to substrate accumulation, causing cellular dysfunction. Now we are focusing on the big three you need for your exams. I've mapped them out here side by side. Tay-Sachs. The defect is hexosaminidase A. The buildup is GM2 ganglioside. The key feature is it hits the CNS but spares the liver or spleen. Niemann-Pick type A or B. The defect is sphingomyelinase. The buildup is sphingomyelin. Unlike Tay-Sachs, this causes massive hepatosplenomegaly. Gaucher disease. The defect is glucocerebrosidase. The buildup is glucocerebroside. This one hits the bone marrow and causes massive organ enlargement, but crucially, no cherry red spot. Let's zoom in on Tay-Sachs disease. I call this the ganglioside gridlock. The problem here is hexosaminidase A deficiency. The result is GM2 ganglioside accumulates in the neurons. The neurons swell up and we call this neuron ballooning. This leads to severe CNS degeneration. Look at the text in red. No hepatosplenomegaly. It is strictly a CNS issue. Tay-Sachs lacks hexosaminidase. Also, Sachs sounds like 6, which means hex. Easy, right? Next up, Niemann-Pick disease. This is the foamy failure. The problem is sphingomyelinase deficiency and the result is sphingomyelin accumulates. This leads to formation of foam cells. These are lipid-laden macrophages that look foamy. Clinical highlight is, unlike Tay-Sachs, here you see massive hepatosplenomegaly. The mnemonic here is no man picks, Niemann-Pick, his nose with finger, sphingomyelinase. Number 3, the Gaucher disease, the crumpled crisis. Problem here is glucocerebrosidase deficiency, and the result is glucocerebroside accumulates. You see Gaucher cells. Look at the texture. It looks like crumpled tissue paper or crumpled silk. You see this weird crinkled cytoplasm. This affects the bone marrow. Gaucher starts with G, so does glucocerebrosidase. Visualize the crumpled Gucci dress for that crumpled silk appearance. For your viva, they will ask you to describe the cells. Here's the showdown. Tay-Sachs, balloon neurons. They are distended with bulged lysosomes. Think onion skin. Niemann-Pick, foam cells. These have vacuolated cytoplasm. Think soap bubbles. Gaucher, you see Gaucher cells. These have a striated cytoplasm. Think wrinkled tissue paper. Let's integrate this with other subjects. Pediatrics, Tay-Sachs. The baby is normal at birth. At 6 months they start to regress or lose milestones and develop a startle reaction. By 2 to 3 years they become blind and pass away. Pharmacology, Gaucher. Gaucher type 1 is compatible with long life. Why? Because we have enzyme replacement therapy. We can inject the missing enzyme. This is a direct link between pathology and pharmacology. Before we finish, let's lock it in with the master mnemonics board. Tay-Sachs or 6 is hexosaminidase. Niemann-Pick, sphingomyelinase. Gaucher, Gucci dress, crumpled silk. Cherry red spot, yes for Tay-Sachs and Niemann-Pick, never for Gaucher.